Well, thank you very much for staying with us on that program, Dynamic, on the Nigerian Television Authority Channel 11, Dynamic Station. Like I told you before, when we went on that break, that we're coming on the Weekly Mirror segment this morning, where we're going to talk about the issues in the health sector. Recently the NMA went on it. 3 days, one is strike, and we're going to look at some of those issues that led to the strike and how has it been resolved so far, and what next in the health sector now as it concerns medical doctors. And I have with me in the studio this morning a man that is the right person to talk about this, because he is the arrowhead for the Nigerian Medical Association in Ondo State. My guest this morning is Dr. Olumuyiwa Alonge. Doctor, you are welcome to the program.
Thank you so much, Marita.
It's good to have you here, sir.
Thank you. Good morning.
Well, Doctor, let's look at the health sector generally. Recently, the medical doctors went on a 3 days morning strike. What exactly was the issue?
Okay, thank you so much, and I also want to say good morning to our audience at home. Let me start first by saying that health workers, the last thing they would love to do is to go on strike. That's the last. And the reason is because we know our role. Health is wealth. A healthy nation is a wealthy nation. And we know that for people to remain healthy, they also need to access quality health care. So we're always there to provide that for them. Before we go on strike, it must have been that we've been putting a lot of pressures on governments to agree or to implement one policy or the other that has to do with health, and we must have done that over years before the need to now go for strike or go for anything that people see outside. So it is not in a way to just go on strike like that. That's number one. Then two, this recent strike action was needless. If governments had done what needed to be done. It's a national strike, it's not a local one. What happened was in 2025 late October, there was a circular that was released after several months of putting pressure to ensure that government implements that circular. Now this circular is not an increase in wage. It was we call it consequential adjustment of our allowances. That means allowances that were supposed to have been adjusted over time since 2019 up till now that were not done was what they asked for. That look, you were supposed to have done this since 2019. So in the last 6 years, doctors have been losing some part of their what should be their income. It was that adjustment that was made and that was implemented in November. So now the backup, because it wasn't part of 2025 budget, it was implemented then. They started implementation through second month, that's February of this year. February, March, it was paid. It was in April. The officers because the national team, we call it IPs, office, the office that disposes salaries to federal government workers, now said that they couldn't implement it because it wasn't in the 2026 budget again. That was what raised the issue, and the doctors were not ready to take that. You paid us for 2 months, you released circular. Are you asking for a reversal? So, and it's not all doctors that also went on strike. It was a group of doctors, the resident doctors. Those are doctors who are in postgraduate training, were the ones that actually went on strike. But what they were pressing for was for all workers. The adjustments for all workers. So, but eventually, they went on strike for a day. And before the end of 24 hours, they were able to resolve things, and then they came back to work.
Okay, so whenever there is a warning strike, of course, a full-blown strike will follow up. Have these issues, have they been resolved, or are we expecting a full-blown strike?
I believe it's been resolved.
Okay.
But the vice president had to wait in, and the vice president gave his word, and they instructed IPs, Minister of Finance.
And that's IPPIS. Minister of Finance, Budget Office, Minister of Health, everyone were involved. Okay. So I believe it's been sorted.
Okay, let me now comment, because we made a mention that when you are fighting, you're not fighting for yourself alone. So does this cut across the health sector?
Yes.
Or it's just for
the cost across? No, it's only for when doctors fight, we don't fight alone unless there are agreements that are peculiar to doctors. When we talk for all health workers, because doctors cannot do it alone, even though we are the head of the team. But we also know that we can only enjoy our work when others are also feeling.
Okay, now this strike, you said one of the issues is about your allowances.
Yes.
Have you considered the equipment you work with? Because it makes your job easy if you have up-to-date equipment.
Not even easy alone.
Yes.
To be able to stand, show that with your counterparts.
Yeah, that's the reason for this.
Sorry to cut you short, sir. It's a trend now in some hospitals. As little as syringe, they will say they don't have. So are you fighting for all these things to be?
We are fighting for, okay, so let me domesticate what we are. Let's come to the local level. At the national level, we keep talking about, the need for, when we say quality health care delivery, so many factors will have to be considered. Yes, the human factor is the most important, but of course there are others. Like you were saying, equipment, materials, and abroad in similar climes, equipments are reviewed every 3 to 5 years. So by the end of 3, 4, 5 years, they will review them. Those ones that are not doing well, there are ways, or those ones that have newer products, they bring them. They have ways of, particularly in the health institutions that are topmost. So they have ways of doing these things. But here it's not so. Once we buy equipment, the equipment we have to work for as long as the equipment can
work with father and their
children. And then to make things worse, health workers are made to improvise. You see, to us now, looking back, it's one of our biggest, let me say it's undoing, to be, improvising. Now, tourniquet, that's something we tie, the string light that we tie on the hands. Only few health centers have what we call the real tourniquet. Most health workers will serve for 35 years without seeing the real tourniquet. Why? Because we are used to improvising. We just cut the tube, the IV set, cut it and use it to be tying hands. It's wrong, but we don't have it. So the doctor and other health workers will improvise. That's why you see them in rooms that will not be so befitting, but they will sit down and still be seeing patients. They do things, no theater lamps. Sometimes they will use touch. So they are used to it, and it's not that they are not shouting. Funding going to health is so paltry. An agreement that Nigeria also is a signatory to is that it shows that Nigeria must commit 15% of its GDP, of its annual budget to health. But what we have is about 5 to 6%, even at the national level, and even the 5 to 6%, the implementation is another issue. So it's a big problem, and so problems that we have in the health sector are multifaceted. Problem that has to do with remuneration and motivation of staff. We are one of the poorest paid in Africa. Even with Africa, Nigeria being a big nation, we have many nations in Africa that are earning far more than the Nigerian doctor. And when you know that you have your friends in UK and US who are earning times Saudi, who are earning times 10 of what you earn. And then you are also saying that, okay, let the doctor, because the doctor most doctors can't do any other job than a life of commitment to what they know how best to do. If they say some doctors have private, what percentage of doctors have private practice? They are very few. So most of them just do that, and that's all. They don't do other things. And so because of that, they also want to ensure that, okay, we are committed to doing this. We should have a fair remuneration for what we do. The doctor will be called anytime. It's even worse now in the era of Chakpa.
Yeah,
most of our doctors have gone. Health centers that used to have like about 8-9 doctors now have 2 or 1. It's of recent, after a lot of pressures locally, that we now have. You have general hospitals. General hospitals are not supposed to have less than 12 medical doctors, because I'm looking at that based on the fact that medicare, we divide into 4 major segments that I may not mention, and then in each of those segments you're supposed to have 3, so 4, 12, make it 12. So a general hospital is supposed to minimum 12. But what do we have today? You have 1 in some places, 2, 6. In those ones that are 1, the 1 will be the medical director. He will be the one to run clinics. He will be the one to do surgeries. He will be the one to follow up. He is the one to expect to do course 30-day call, and you want to also be at work in the morning. Hey, you are not a ghost. So you see, it becomes, even now that they are making them 2, it's still not solving the problem. So we are calling on the state governments, like Ondo State government. The level healthcare was in 10 years or 2014, 2013. They are no longer there now. The ratio of a doctor to patients in Ondo State, with a population of about 6 million people, and looking at the number of doctors practicing registered with the American Dental Council of Nigeria, that's the body that we register for practice every year, in 2024 is ratio 1 doctor to 6,500 populace. Wow. Now the WHO standard says 1 to 600. 1 to 600 people. That's the standard. The best we have in the nation is Lagos. That's 1 to 2,000. Okay, and even in the entire southwest, Ondo State has the worst ratio with 1 to 6,005. Oyo has 1,000 to 3,005.
1 to 3,000.
Osun has 1,000 to 4,000 or 4,002. Osun. Ekiti here has 1,000 to 4,500 people. We have 1 to 6,500. Wow. So, and it wasn't like that in 2014 or 2013 when we were like the mecca of doctors in Nigeria, in southwest after Lagos. Ondo was next. So what has gone wrong between that time and now? These are questions we are asking, and that's why we are also asking, we are appealing to governments. They must please help us invest more in getting doctors. Are not looking in the direction of Ondo, and there are every state governor now is now beginning to they are beginning to come up with innovative ways to keep their workforce. They are beginning to have innovative ways of creating their workforce. So these are the circular that was released that led to the strike dimension has not been implemented locally. So our local doctors, so it's the federal government in federal ones in those in Federal Medical Center that are receiving it now. Okay, so the ones in the state are yet to this is the 3rd month. And they are getting restive. They are not happy about that, and all the health workers are complaining. And so when you have a workforce that is overworking, you have the staff that are overworking because they are doing far more now. They have to do more course. They have to do more because there are few people on ground. So they are overworking, stressed, they are underpaid. They're underpaid. They don't have the right equipment. Ondo NMA came up with a master plan, came with a position paper on what government will need to do to lift up the quality of healthcare in the state. We submitted this to all stakeholders, including His Excellency. I know they are looking at it, but we would love it if they can speed up action on them. Those general hospitals we have needs interventional funds, because there are some general hospitals today that don't even have fence, that are not fenced. There are some general hospitals today that don't have when I was one of the meetings that we had with the governor, I told him, if you want the doctor to stay in the hospital, they should live in. There should be quality accommodation made available for them. They will stay. The only hospital in the Ondo State that has that facility is the General Hospital in Ondo. And the doctors, up to today, they are there. So, but when a doctor lives 10 kilometers away and there is emergency here, and you're now calling the doctor to be, things don't work like that. Life that you need to save may just be few minutes. So there are some doctors today, senior ones, grade level 17, grade level 16, who don't have office. So when they finish the daily work rounds, and there's nothing to do for some time, there's no place to sit. Not even doctor's lounge, not even doctor's office. A doctor of grade level 14 should have an office.
Or a changing room where you rest or something.
An office.
Well, thank you, Doctor. But let me also bring your attention to talking about security. Recently, we had cases of some health facilities being attacked and the rest.
Yes.
What is NMA doing in this direction?
Okay, thank you. Yeah, our position paper before, it was as if we saw it coming. Even though we never envisaged it to ever happen. Part of what was in the position paper that we had released long before now was the need to pay attention to security. In the workplace, one thing that can make you be at peace is knowing that you can be protected in case of any attack. Health workers are usually objects of attack. When relatives or patients are not happy about one thing or the other, the next thing is to want to attack either the nurse or the doctor that is on duty, or any health worker that is around. So that has always been the trend, and that's even part of the reason why some of our colleagues left. I know doctors that left because they felt, no, there is no protection like that at work, in the workplace. That those are left because of remuneration, that those are left because of general insecurity in the nation. Okay, so, but those of us that are staying in decide to stay not because we don't have opportunities coming, but we also have individual reasons why we are staying in, and not everybody will also go. If we go, we'll train the ones that remain. So those ones also needed to be trained, and so we also must. It's a sacrificial thing because it doesn't take long to travel. You just go and change life and then earn more.
Okay,
so that's
so with respect to the insecurity, please let me quickly answer that.
Okay.
With respect to the insecurity, we had requested, because there are some general hospitals even without a security man, without fence. That's not the general scenario everywhere. There are those that have them. The big general hospitals have security, they are fenced. But there are some general hospitals in the communities, no fence, and then no security man. In fact, some, no gardener. Okay, so the last time these people were employed, I think we are looking at employing new ones now. The last one they were employed was 2013. Wow. So between 2013 and 2025,
that's a long time.
There was none of those supporting workers were employed by the state government. So now it's now left to the individual general hospital to see if they can get some people they will be paying to do some of those things. So it's an issue. But I know they are now looking at it now to ensure some are brought in. To me, that's so part of the position paper was that we should look at security. Security people must be employed because the hospital is only for doctors and nurses. Those people have their roles. And then 2, CCTV must be everywhere. I'm happy now, and I thank the state government, His Excellency Governor Lucky Ayedatiwa, for beginning to do that. That's after the attack that you mentioned. That attack shook all of us, and they threw us into panic mode. The workers, particularly the nurses who will be on duty at night, and even the doctors were reluctant to go back to work. And we had to have a number of meetings with the commissioner and then the permanent secretaries in health, and we constituted a committee. I was a part of that committee that came up with suggestions, which included the need for all general hospitals, even all hospitals, including primary care centers, to have CCTVs installed. They've started that now in a pocket of places. I believe it will go around over time.
So I'm talking about having few hands to run the hospitals.
Yes.
Before the government comes to the rescue of the medical practitioner, what are the things what are the body or your association putting together, for coping mechanism in order not to overburden the people working already?
Yes.
They could experience exhaustion or mistakes could occur. So what are you people doing to ensure that these people work efficiently?
Thank you. I wanted to say something before. Now that you said this, really, you see, when we are asking for more doctors, more workers, it is because of the people. When you have an overstressed doctor, it's dangerous for the patient. Somebody who is stressed he has not slept is tired. Now you now come and you want the best out. He may write things, he may write a wrong dosage for you, he may write a wrong drug, he may write a wrong prescription, he may write a wrong prescription for you
during surgeries.
People think that we are, you see, people tend to think that we are we cannot fall sick, we cannot. But today there are doctors that will tell you that I don't even feel like going to work.
The doctor even collapsed.
Yes, doctors collapse in the theater, doctors collapse in emergencies. It's happening.
Doctor, I'm sorry, let me ask this question.
But he has not finished rounding of this, so it's very important. Okay. So how are you trying to help out those who are working already?
Okay, so yes, one, we've been engaging governments to get more doctors. Not only doctors, more health workers, nurses, pharmacists, everywhere is, there are few numbers. We are out on the staff everywhere. So we have been putting pressures, we've been appealing to government, and they came up now with a press release asking for people to apply. An advertisement for people to apply for job. I hope that will happen. That people will. But the first thing first, there must be an attraction to Ondo State. If you are used to using the same old rates and we expect people to come, we talk to people. We engage doctors, young ones, or people to come. They say they can't come to Ondo State today. They can't come. There are doctors today who are in Ondo State, in Akure here, who are in private hospitals. Mm-hmm. Because what they earn in some private hospitals now today is twice what they will earn in government. Mm-hmm. There are doctors today who are with NGOs. Mm-hmm. Now the non-government they have doctors.
That's true.
They see employ some recently, and we are not getting. So there is a question, there's an issue there, and so we, even when in 2014, when we think our subvention was even lower, we had times 4 the number of doctors and workers that we have now. So question is is about focusing on it and giving it the right, it's about the people.
Well, doctor, let me ask this question because you are trying to do much as an association. How much are you engaging or collaborating with other professionals within the health sector? Because sometimes it seems doctors are only fighting for themselves. Doctors are greedy. Doctors are selfish, and because recently I heard a group talking about medical doctor wanting to take over every aspect of the head. They must be the one heading lab. They must be the one heading this, heading that, and that seems to some people that doctors are selfish.
Okay, so
are you working with other?
Okay, thank you.
So know that we are on the same page.
Okay, thank you. I think it's a good question, but let me say here, the way our professions, our trainings, are doctors. The doctor is central to the care that will give patients. It's the doctor that will foresee the patient. If he thinks the nurse will need the nurse attention, sister, please let us do this, we will do that. If you need lab, you need to go to lab. If you need physiotherapist, okay, go and assess physio. You can see they are central. If you need anything, so the doctor is at the center. No other worker is as central to, for example, now the lab person, if he thinks that the patient will need physiotherapy, the lab cannot send the patient to physiotherapist. The lab can only advise, go back to your doctor, who is central to that you should consider physiotherapy. Can you see? So the doctor is central, and that is why it's appearing as if they want to take everything. It's not true. Everybody have their roles. The pharmacist have his role in practice, in drug procurement, drug safety, and even in drug production dispense, they dispense, and they also produce. If the facilities are there, they can produce some. So they have their role. The doctor have theirs. But what made it look as if the doctor is because they are
being overbearing,
is because they are central. Is because they are central. The doctor knows the operation of all areas. If you look at the history of medicine, it started with the physician. It was when the physician now knew that you can